country of Philippines. It's been a long journey for me. I'm about to end my term. And I started it in Korea, if you remember. I think I didn't recognize the president of the Medical Women International Association, Dr. Park. Is she here? There she is. I started off there, and I got the women's blessing. My fellow women blessed me. Then I moved to Taiwan, and I had a very nice visit there and blessing. How befitting it is to almost end my trip back in this region, in the Philippines, because I've always wanted to come to the Philippines. Jojo, you've always invited me, and I'm very happy to be here. I bring you warm greetings from the chair of the Council of the World Medical Association, Dr. Mukesh Haikera, who could not come because of other duties, and the Secretary General, Dr. Otmar Kloiber. I also bring you greetings from my own association, the Uganda Medical Association. Uganda, as you all know, is a small but beautiful tropical East African country on the shores of the largest lake in Africa, Lake Victoria, where the source of the River Nile is, the longest river in Africa. It has a population of 36 million people, very friendly people, and is also known as the Pearl of Africa, a name given to it by Sir Winston Churchill because of its beauty. Oh yes, I also add, it has the largest population of mountain gorillas. So please come and visit. You're very welcome to visit Uganda. I begin by repeating what many have said in the last couple of years, that though since 1990, the world has made considerable achievement in improving the health of the people of the world, many countries will not achieve one or more of these Millennium Development Goals, and the contributory factors are many. They include natural disasters, wars, climate change, the global economy, undeveloped systems, weak health systems that are not able to deliver the equitable distribution of health services, efficiency, effectiveness, patient-centered care, responsiveness, and ethical care that is needed to address the huge burden of diseases that we have on this planet. As we enter the 21st century, because we've just entered it, we as physicians are confronted by several contextual issues, including health reforms, which in low and middle-income countries include devolution or decentralization of health services, new policies and laws, and some of them have negatively affected the way we work. Migration of health workers, both international and internal, continues to be a major challenge. This crisis has affected us, many of us as physicians, including those working in high-income countries. Now, the heavy workload, especially in rural areas, remote areas, and the weak primary care services that we have in many parts of the world has demotivated physicians, worsened the brain drain, and further weakened the health systems. This has particularly weakened the primary care systems, where physicians are still very necessary for the planning, coordination of services and supervision at those levels. The universal trend is private sector-led economies, and these provide physicians with more opportunities for employment in that private health sector, but providing more new challenges. Now, during this century, countries like Syria and Somalia continue to experience wars, while others like Southern Sudan have just started. The nature of armed conflict has also changed over time, with health services, including ambulances, and health workers, including physicians, increasingly being targeted. Many physicians have either been injured or killed, while others have had their families threatened in situations of conflict and other emergencies. The World Medical Association has joined others, like the International Committee for the Red Cross, in advocating for protection of health care in armed conflict and other emergencies. The WMA's role in the Healthcare in Danger project of the ICRC is to encourage national medical associations and physicians to document, to report incidents of harassment, threats, assaults, and killing of health workers, and to work closely with their Red Cross in their countries to advocate for protection of these health services and health workers. And that is my appeal to you in your various countries. With globalization and as we enter the information era, comes the development of the social media and other information technology. This is a welcome development in the building of an information society. But it too has challenges for us as health professionals, as the discussions over this week will probably show. As physicians, we shall be confronted with patients who have misinformation from the information they pick up from the social media. And this is very highly shown very clearly in the response to the Ebola epidemic. I think you've heard in Guinea that people have all sorts of misperceptions about the cure and the cause of Ebola, and as a result making it difficult for the response to be successful. Now, as physicians, as we enter this century, as we enter this 21st century, then came the global economic crisis, which resulted in further worsening of the situation, as donors drastically reduced their contributions to poor countries. Now, health financing has definitely become a bigger challenge, contributing to a poorer access to health services for large populations, not only in middle and low-income countries, but also in high-income countries as well. The percentage of the GDP which is spent on health by many governments in the world continues to be low, and the public-private partnerships which are desired are still inadequate in many countries. The high health costs have already pushed more than 100 million people below the poverty line of living on less than $1 a day. And millions of people continue to die from preventable conditions. On a positive note, however, even poor countries are looking at various health financing options, like national social health insurance schemes. And we see in Africa, for example, I shall talk more about it tomorrow, as many countries experiment on these national social health insurance schemes. In addition, the public-private partnership policies have encouraged the involvement of the private sector. But the area which is most neglected when allocating financial resources continues to be health information management and research. Yet scientific data is very necessary for ensuring evidence-based policies and services, and prevention and health promotion is becoming increasingly necessary with the pandemic of lifestyle-related non-communicable diseases. But in some parts of the world, the systems have weakened so much that they're not able to cope with outbreaks like Ebola, and therefore making it even more difficult to cope with the other illnesses. And yet these countries have to build an information society that will overcome these challenges. Another challenge for us as physicians, even in some countries like I've mentioned, is the plethora of other key players and stakeholders that we must work with. These include other health professionals, community leaders, citizens, industry of all kinds, NGOs, private sector, charity organizations, traditional alternate medicine, and patient support groups, among others. Our main challenges, therefore, include conflicting priorities and lack of appreciation of each other's roles and methods of work. And in many parts, traditional and alternate medicine continues to be unregulated. So interprofessional collaboration and practice is increasingly important. And as physicians, we need to appreciate the roles of our fellow health professionals and develop approaches of working together. We are also expected to provide others in the places we work with effective leadership. Effective leadership means motivating others, supporting them, maintaining good communication between us and them. And to be able to address all the above challenges I've mentioned, we must play different roles. One major role is to become a change agent. Changing what? Changing perceptions of those different stakeholders. So what are those roles that we are going to be playing as physicians of the 21st century? Health promotion, advocacy, public relations, resource mobilization, networking and collaboration, entrepreneurship, leadership, governance management, etc., etc. I therefore wish to support the paradigm shift in the way we educate physicians. Let us raise the profile of competences which until now had been considered non-core competences and make them the core competences. And let us use experiential learning, practical hands-on training, and increase access through innovative e-learning approaches. The above issues, as I've mentioned them, call for very innovative approaches to training, and we have no choice but to go in that direction. We need to strengthen networking as an effective way of sharing information on these issues. I would therefore like to congratulate SMAO for the good work you are doing in providing a regional forum where national medical associations and physicians working in a similar social, economic, and political environment are able to share experiences, learn from each other, and collectively find ways of overcoming challenges. You do realize that SMAO is older than me. I'm quite embarrassed. I didn't know it was that old. It's older than me, and therefore I salute SMAO for that. Now, as World Medical Association, a global professional body, we encourage you to continue to encourage physicians to fulfill their ethical obligations and to therefore protect the rights of patients as laid down in the Declaration of Geneva. The principles underlying medical ethics continue to be compassion, competence, and professional autonomy. And compassion, competence, and professional autonomy. This year we shall be celebrating 50 years of the Declaration of Helsinki, and the celebration ceremony will be held on the 11th of November this year in Helsinki, Finland, and you are all invited to attend. My appeal is that you ensure that physicians in your countries and others involved in human research are familiar with the DOH and use it to protect the rights of their communities as they participate in research. And as we move through this 21st century, the WMA will continue to play its roles of promoting ethical standards and working hard to ensure that every single person in this world has access to quality health and healthcare. It will continue to offer you guidance on ethical issues in healthcare and opportunities for capacity building, networking, and collaboration on global level advocacy. As the dialogue and consensus building on the post-2015 agenda continues, our appeal as WMA is that you continue to strengthen your efforts on changing lifestyles, addressing tobacco, harmful use of alcohol, and other social determinants of health. As you know, social determinants of health are the causes of the causes. They are the conditions in which people are born, in which people grow, live, work, and age, and die. And the societal influences on these conditions, they include poverty, lack of education, poor housing, climate change, and others. I wish to end by one more appeal. Let us as physicians continue to have the patient at the center of the work that we do, respecting the rights of patients and remembering that humanity has given us the privilege to serve. It is a privilege, and therefore we should not take it for granted. We are here because of our patients and not the other way around. And again, I thank you for the good work that you continue to do despite the challenges. And I wish you all a fruitful meeting this week, and thank you for listening.